Good day, ladies and gentlemen, and welcome to the National Prevention Week 2019 webinar series. Thank you so much for joining us. Today's webinar is being recorded. I will now turn the webinar over to our moderator, David Lamont Wilson from SAMHSA. Please go ahead, David.
Thank you. Welcome, everyone. I am David Wilson. I am the Public Health Analyst at the Substance Abuse and Mental Health Services Administration, or SAMHSA, at the Center for Substance Abuse Prevention, or CSAP, and I'm also the coordinator for SAMHSA's National Prevention Week program. And I will be your moderator for today. So today, I want to start by saying working in public health communications, we know how national health observances, activities, and events provide opportunities to gain attention and hopefully movement for our work. In substance use prevention, national health observances can offer platforms for state and local health programs, for campaigns, and I dare say initiatives to showcase and market their achievements and benefits to larger audiences, gaining more prevention champions and hopefully greater impact, which is why we're here today. I'm hopeful that today's webinar will provide the approaches and ideas and resources to help you answer that question that I hear all the time, which is, how do you use health observances such as SAMHSA's National Prevention Week as opportunities to communicate the value and impact of substance abuse prevention to potential supporters and partners, and for many of you on the phone, funders as well. So today, I think we have the right people on this panel to do just that. Our panel of speakers will be sharing social marketing principles and, more importantly, real-world examples of how to use NPW to take center stage and better market your prevention messages and inspire individuals to action, which we all know changes lives. But before we begin and get to the meat of today's webinar, I do have a few housekeeping notes that I want to share with everyone. One, please use the chat pod to send us your thoughts and questions throughout everyone's presentation, because we're planning to have a question and answer session at the end of the speaker presentations, and my colleague, Crystal Borg, will be conducting that Q&A session. Two, this webinar is being recorded, and it will be available on SAMHSA's YouTube page. So if you have colleagues or individuals or coalition partners who weren't able to join us today, they can access it on demand when it is available, and they will be able to see it and reuse it at their leisure. And three, we will make the slide presentation available after the webinar, so you'll have the information and the resources that we discuss at your fingertips. Let me say that one more time. We will make the slide presentation available after the webinar. All of the slides have great data, resources, strategies, everything from this webinar. So, lastly, I just wanted to say that today's webinar is the second in our National Prevention Week 2019 webinar series, and it is one that is designed to help amplify the great work that individuals, organizations, and communities are doing across this country. Our webinars will be exploring the intersection between different health themes within substance use prevention, as well as focusing on special populations who have been specifically impacted by substance misuse trends and consequences. And as I mentioned earlier, you can find the past webinars archived on SAMHSA's YouTube page and on the NPW website. We will be sending you the registration link for the December webinar following this webinar. Now, time to introduce our four exciting presenters. Starting our conversation today will be my NPW colleague from Vanguard Communications, Carolyn Fearing. Carolyn is a social marketing specialist and guru who has a lot of experience helping CBOs and grantees like yourselves use social marketing principles and national events to amplify their messages and impact. And then I'll share some information about resources that will help you use national observances and programs like NPW and Communities Talk town hall meetings as opportunities to reach new audiences and market the great prevention work that I know you guys are already doing. Then we will hear from two community-based organizations who will share how they have used social marketing and their NPW involvement to take their prevention work to the next level. And then we will be joined by Crystal Bava, representing the Hawaii Partnership to Prevention's Underage Drinking Together We Can program, and Lori Badura and Sara Lavalier from Saving Others for Archie, based in Wisconsin, which works on opioid misuse prevention in honor of Lori's late son Archie, who died from an overdose. And we are honored that they are all joining us today and sharing their experiences and, most importantly, their ideas. So, our first speaker, Carolyn Fearing. She is a skilled communications professional with more than 20 years of experience in community health and social marketing opportunities. And over her career, Carolyn has helped a broad range of organizations, including SAMHSA and other federal agencies, nonprofit organizations, associations, and corporate clients. Her experience includes communication strategies, message development, testing, materials planning and development, as well as media analyst and outreach. Carolyn has overseen outreach and communications for major government data releases on community health, including providing support to federal grantee communities to widen their dissemination. And lastly, Carolyn has worked for AARP for 5 years, including work on their Livable Communities initiative, promoting walkability and bikeability for seniors. She holds a Master's of Arts from Purdue University and is fluent in English, Spanish, and French. Whew! She has a lot to offer us today. So thank you so much for joining us, Carolyn. We really appreciate your time and expertise.
Thank you, David. I am going to now go on LinkedIn and add social marketing guru to my profile. I'm so excited. So welcome, everyone. Thank you so much for joining us. I'm very excited to talk to you about social marketing, which, I'm going to be a little bit kind of theoretical, but you're going to hear some wonderful examples from Hawaii and Wisconsin of this being put into practice. So you may be asking yourself, well, what is social marketing? There's a definition right here, and most of you, even though you may not know it, are probably already doing social marketing. You might not call it that, but social marketing is the marketing of behavior change that benefits society as well as the audience. So it's been around since the 70s. It kind of combines marketing theory, behavioral science, psychology, and it's often used in health communications, and it's kind of been the official approach of health communications for the federal government for the last couple of decades. So it is about communications and raising awareness and changing attitudes, but if you're a total social marketing purist, it's really about thinking about what's the behavior that you want to change and understanding that in order to change people's behaviors, there has to be a benefit to the people that you're trying to reach, not just to you. So we'll talk a little bit more about that in a minute. Next slide. So some of you at this point are going, wait, what? Social marketing? I thought that was Facebook, Instagram, and Twitter. And it is a little confusing, but as I said, social marketing, the kind that we're talking about today, has been around for quite a long time. And although it does include using social media as a tactic, it's obviously very different. So here are some myths about marketing in general and social marketing as well, that it's just a photo op. It's all about the media outreach and advertising and social media. We can only do it if we have a ton of money and we need a big flashy campaign. And all we need to do is just go out there and spread our message and tell people what we want them to do, and they're just going to magically do it. But I want you to go back to that definition I showed at the beginning, which is that social marketing has to have a benefit to society, but it also has to have a benefit for the audience. Next slide. So another myth about marketing and social marketing is it's just fluff. It's just an event. It's just PR. But what I want to show here is that it actually makes a real contribution to sustainability. It can change attitudes and beliefs and behaviors. We want to see more people taking prevention actions every day. Next slide. Thank you. So here's some evidence that social marketing is meaningful. These are all sustainability practices within the strategic prevention framework. Stakeholders, engagement partners, and influencers. One of the outcomes that you have, you can demonstrate those through social marketing. You can involve program champions, and you can get your community involved. So social marketing is a sustainability tool. It's not just fluff. Next slide. So here's the mean cat. I'm going to go back and at the end of the presentation, but here's the mean cat with a very shouty cat with a megaphone who's making lots of announcements. But what I want you to think about is before you pick to spend some time. It's not just us design a poster, but we need to think about why we are designing a poster. So where a lot of us often start, especially if we don't have a lot of experience with marketing and communications planning, is about halfway around the wheel where you see kind of the bottom left, the activities, events, and materials, and we just dive right in to those things because those are fun and exciting. How can we achieve that mission, and how can communications realistic change can we questions that help you formulate a goal? And there's an example on the next slide of a social marketing goal and how it ties back to a program goal. So if your program goal is to enable more people to seek behavioral health services, your social marketing goal might look like this: reducing negativity associated with seeking services, or educating thought leaders about the importance of access to services. So now you have a goal. The next step in the process is the audience. So the one thing that you really want to think about here is who is affected and whose knowledge, attitudes, beliefs, behaviors do you want to change. So if you have the community or the general public as your audience, you're not going to be as effective in your communications because that's too broad. You really want to hone in on a specific audience. So even saying parents might not be specific. You really want to target it to something like parents of teens and tweens, or instead of employers who've demonstrated a commitment to health and wellness. So being very targeted there is really important. You cannot reach everyone in the community. You don't need to reach everyone in the community, and you probably don't have the money to reach everyone in the community. So once we know who our audience is, this is a really important step in social marketing, because remember, we need to figure out what are we giving our audience in exchange for asking them to change their attitudes, to change their beliefs, and change their behaviors. And this is really the crux of social marketing, and it could honestly be a whole webinar in and of itself. But you want to think about, you want to put yourself in your audience's shoes and think about, well, what do they think? What are their feelings? How are they acting? What is stopping them from changing their beliefs or their attitudes and their behaviors? What would motivate them to change? And also thinking about who is most likely to change. Don't go after the hardest people to reach. Go after the low-hanging fruit, because those people in turn can help influence a wider audience eventually. So after we've done some thinking about who we want to reach, what makes them tick, we are into developing what we want to say to them, so our messages. And the main thing to think about with messages is you want to highlight in those messages the what's in it for me. Not what's in it for me as the prevention community, but what's in it for the audience that you're trying to reach. Next slide. So when you construct your messages, you want to think about, how can we demonstrate the urgency of this issue? We want to put a face on the issue. We obviously want to be culturally competent, but again, going back to the what's in it for me, the messages should be tied to what your audience cares about, their values, their beliefs, and their interests, and not what you care about. So just to give you an example, if we were trying to reach employers, for instance, with a prevention message, a not very what's in it for me message might be, oh, it's the right thing to do, and your employees will be happier. But do employers really care about either of those things? Maybe they care a little bit about their employees being happier, but I think they care a lot more about saving money, improved productivity, and return on investment. So that's an example of a what's in it for me message. And then we'll get to this in a minute, but making sure that before you turn those messages into a poster or a brochure, which costs a lot of money, that you get some audience feedback on those messages. And then we want to think about how will we reach our audience. And oftentimes when we hear channels, we think, oh, this is media outreach, this is newspapers, it's radio, it's TV. But don't exclude really important channels like community thought leaders, important local leadership as well could fall under this group. All right, we are finally at where we usually start, which is with the activities, events, and materials, but think about, all the work that we've done to get to this point. And if you have done all that work, thinking about your goal, your audience, your message, and your channels, this part will be so much more effective. It will make a lot more sense, because what you'll start to do, if you go to the next slide, is ask yourself, when we do all of these amazing activities and events, and create all these wonderful materials for Prevention Week, are they helping us reach our goal? Are we actually reaching the right people? Are we saying something that's actually going to motivate them? This could all be so much more effective with just doing a little upfront thinking. Next slide. So I just talked about very briefly pre-testing, which is a step that we often skip because it takes time, frankly, and it's a little bit cumbersome sometimes. Which is basically just getting feedback from your audience. Now, it doesn't have to be like a formal focus group. You could basically show your messages to members of the audience that you're trying to reach. Look for red flags. Make sure that the language is culturally competent and makes sense and resonates with them. Even better, you could co-create your messages with your audiences for your planned activities. You could involve, if teens and tweens are an audience, you can involve them in creating those messages and in creating the materials that you are putting together. And then the final step of a good social marketing plan is evaluating and making any changes. Now, of course, for Prevention Week, it's a little hard to make mid-course corrections, but you could make corrections based on your evaluation for the following year. So you could look at outcomes such as, the number of people that you've reached, the number of people that have attended events. But if you are able to maybe do a quick survey at one of your events and ask people there if it's changed their thinking, that's a great way to also use your event as a way to gather data and information. All right, so to make sure everyone's been listening, we have a very quick poll. So you will basically click on your response here, and the question is, before you conduct your National Prevention Week activities or develop your materials, what should you think about first? The location, the weather, and local celebrities, your goals, audience, and message, the theme, color scheme, and volunteers. So which of those is the right answer? We want to see 100%. So if you would just go ahead and click on the correct response, we're going to take a look at the results in just a minute. Woohoo! We have 100%. Yay! All right, so I'm just going to wrap up by going back to, because I'm a total dog person, going back to Mean Cat, who just goes out there without thinking and starts spouting their message, to Nice Dog, who is listening to their audience and getting all that wonderful feedback and planning before they go out there and do things. And if you have questions, I'd be happy to help. Just shoot me an email, and I will be happy to give you feedback.
Thank you so much, Carolyn. Thank you for laying the foundation for what it is that we're going to be talking about for the rest of the webinar, and more importantly, in my mind, for reminding us that there is a science and a methodology behind social marketing and health communications. Also, what you've done is you've provided this perfect platform that leads into what I'm going to be talking about, which is what social marketing can do beyond what you just mentioned. All of us in different ways are kind of striving to influence or change health behaviors related to substance use prevention. And we can leverage national health observances to do that for us. So how does tying prevention actions, activities, and events to national health observances like NPW, how does that align with your overarching health communications plans? Next slide. Leveraging national health observances can help you achieve the same outcomes as social marketing. And I like to think of it as social marketing provides the game plan to ensure that your interconnections to national health observances do really amplify your work and your messages. National health observances provide that platform. And the great thing about NPW as a national health observances is that it is free to organizations and individuals. We have done most of the groundwork for those organizations who don't have all of the resources or the staff to do much of that foundation work. Next slide. Now, if you are a prevention grantee, then this illustration should be very, very familiar to you. For those that it's unfamiliar, this is SAMHSA's Strategic Prevention Framework, or the SPIF. And the SPIF is a five-step planning process, not very different at all from what you've just seen in Carolyn's presentation. It's a planning process for substance use prevention coalitions, initiatives, and campaigns. And at SAMHSA, we use this framework to ensure that our programs, our grantees, and our initiatives are successful. Also, this framework helps communities more effectively understand and deliver prevention practices as part of the social marketing process. and the social marketing process that Carolyn walked us through integrates beautifully with the fifth. In this framework, social marketing is an essential component for the success at any part of the cycle. Now, I'd like to introduce you some of those national health observances, including National Prevention Week, that you can use and leverage through social marketing approaches to amplify your efforts and your messages. Next slide. SAMHSA's National Prevention Week is an annual health observance in May dedicated to increasing public awareness of and action around mental and/or substance use disorders. And each year, leading to this observance, and during the actual week of NPW, communities and organizations across the country come together to raise awareness about the importance of substance abuse prevention. Now, the focus of this year's NPW is inspiring action, changing lives. And this theme reminds us that we can all inspire positive change throughout the year, every day and everywhere, whether we make healthy choices for ourselves or inspire others to do so. Those small actions we take can change lives for the better. Next slide. Now, like I've said, NPW is an annual observance dedicated to increasing the awareness of substance use and mental health issues. And as you can see here, our goals focus us on the activities and events and the resources that we hope to achieve for NPW. Capturing your successes and knowing what works for you is important for NPW this year. We know that organizations and coalitions and communities are doing great work in the field, and SAMHSA wants to hear about that. So start planning your prevention activities today. Track your progress and your growth, measure your reach and your impact, then share all of that success and that progress with us. We're trying to build this coalition of prevention success. And then, of course, for those of you who are really, really good at promoting your impact, perhaps we will feature your organization, your coalition, or your community in one of our upcoming webinars. Visit the NPW website to connect with us. Next slide. Because NPW in its purest form is an opportunity for communities and organizations to have a year-round conversation about substance use prevention, positioning activities in May to be the culmination and the amplification of your prevention activities that are taking place every day all through the year. Next slide. As you can see here, each day during NPW in May, we focus on different and pressing important health themes, and we encourage you and your communities to discuss various aspects of prevention and the impact that those themes have on your communities. Communities across the country have hosted health fairs, trainings, mural paintings, town hall meetings, Twitter chats, and as you'll be able to hear from our other panelists, a lot more activities to contribute to this growing conversation that we're trying to have around prevention. Next slide. Now, what makes NPW a great opportunity for community-based organizations working on substance use prevention? I'm about to tell you. There are three clear benefits in my mind. One is community-led activities and events can be anchored by 5 of the National Prevention Week prevention topics. 2, there's online promotion, engagement, and conversation around these substance use prevention topics. And 3, we offer opportunities to create and maintain collaborations at local, state, and national levels. And together, these NPW activities, of course, help to raise public awareness. They reinforce healthy attitudes and behaviors. They strengthen coalitions, and they market your prevention work and your messages. Next slide. SAMHSA has many, many resources available to you to support your NPW marketing efforts. So we want you to make sure to sign up for our Prevention Works email. When you do that, you'll be able to find the form to sign up on the NPW web homepage in the lower right-hand corner there. You'll be able to check out the tips and the customizable materials, like I said, that we've already done the work for you. That is available in our NPW toolkit, and it's also posted on the website. Because finally, we want to know, like I've said before, the amazing and impactful work and activities that you are leading in your communities. Use our community activity and events forum on the website to share those details and all of that impact. And send us, if you can, high-resolution photos and videos that we can showcase of the work that you're doing. In our 2019 outcomes report and Prevention Works emails. Next slide. I also want to take this time to let people know that we also do something that's called Communities Talk Town Hall Meetings, which is another National Health Observance opportunity. And you can take advantage of this opportunity to leverage, especially in your coalitions that are focused on underage drinking prevention. Use this observance. These events have been held nationwide every 2 years since 2006 to educate communities about underage drinking, to activate communities around proven solutions, and to sustain that prevention momentum. Now, since Communities Talk Town Hall Meeting events began more than a decade ago, there has been a steady decline in underage alcohol use nationwide. Like in 2006, about 11 million 12 to 20-year-olds, which is about 28%, reported drinking alcohol in the past month. In 2016, that number has gone down to about 7 million, 19% reported alcohol use. Now, these events have engaged hundreds of thousands of communities in prevention efforts. And in 2016, roughly about 1,500 communities talk town hall meetings were held. Next slide. As you can see, communities talk events host communities receive numerous benefits from their participation. And more importantly, these events serve as catalysts for action in helping youth, families, and communities avoid the harmful consequences of underage drinking. Next slide. SAMHSA provides community-based organizations, colleges, and universities nationwide with a stipend, along with free tools and materials to assist them in planning and hosting communities talk events. Now, these resources include tips for planning a communities talk event. They include resources to engage youth and success stories to showcase other successful events. So I urge all of you to visit stopalcoholabuse.gov to download the latest Communities Talk resources and the latest update on how to get your community-based organization involved. This is a wonderful opportunity, and I will add that I know most of you are familiar with it as it relates to underage drinking, but you can also use the opportunity with these stipends to not only talk about underage drinking, but other topics as well. We know opioids is the big topic of the day. You can talk about the intersection of underage drinking as it relates to other health topics. So I really encourage you to take advantage of the town hall meetings. So, next slide. As I've said before, every day, week, and month, there is a national health or cultural observance being marked around this country. As you can see, here are a few examples of national health observances that can provide additional opportunities throughout the year for your organization to market your prevention and your work and reach new audiences. Now, we will be featuring many more of these observances in the new NPW 2019 Resource Guide and Planning Calendar, which will be available for you very soon, next month. And make sure that you've signed up for the Prevention Works email so that you will be the first in line to place your orders. It was a very, very popular award-winning piece last year, and we're anticipating that it will go quickly again this year, especially since it will feature a new augmented reality function. Intrigued? So stay tuned to get your copy and start your planning. So lastly, I just want to say again, I'm David Lamont Wilson. I'm the coordinator of National Prevention Week, and here on this slide is my contact information, especially about NPW materials and resources. So I'm going to stop talking. I'm going to pass it on over to our next panelist, Ms. Crystal Bava. And she's going to provide the State Prevention Coalition perspective. And I'd like to welcome one of our also NPW 2019 working group members and partners. She has been so helpful in helping us construct and plan some of the events and activities that we are doing for 2019. Crystal joins us from the beautiful island of Hawaii. And as a criminal justice grad, she took very quick interest in prevention, knowing that there had to be a solution before reaping the consequences of underage substance misuse. And through her passion, as you will hear, with working with her peers and mentoring youth leaders and youth, Crystal rewards herself through her work as the coordinator for Hawaii Partnership to Prevent Underage Drinking, which is an island-wide prevention coalition. So without any further ado, aloha, Crystal.
Mahalo, David. Aloha. So again, I'm Crystal. I'm the coordinator for HPUD for short, because Hawaii Partnership to Prevent Underage Drinking is a bit long, so we do call ourselves HPUD. I'm clearly new to prevention, just going on our third year, but very excited, and a lot of my excitement is thankful for National Prevention Week. At the bottom is my contact information, or our coalition's contact information and social media sites. Please feel free to contact us for anything. We are always open to sharing what we create and sharing ideas and bouncing back ideas. So please feel free to contact us. And just a little, hoping you guys are enjoying your holidays. That's our little cute logo there. Next slide, please. So this is our coalition in a nutshell. Our island, to just give some feedback, if you've never been to Hawaii, one, please come and visit us. We are an island of almost 1 million people, so organization is key. And to this million, our coalition, I am a one coalition staff member, so structure is everything to us. Hiki no Kako is our youth chapter, and that is fully youth generated. As you can see in kind of the right-hand side, our structure, how it goes is we have our chairs, our board, which oversees our youth section, our membership, and I really want to emphasize this. Our short-term action team, STAT for short, and we specifically have an NPW STAT. And this STAT just takes on just NPW. This is important to us because it allows those who are really engaged in National Prevention Week to not feel committed that they have to do everything that the coalition does, because they are specifically only interested in NPW. And we did go through a struggle with our grant. We are a Partnerships for Success grant. We had worry of our grant not extending, and this was through our planning of National Prevention Week. So passing on our responsibilities and really getting involved with our stakeholders and our partners, and most importantly, our youth, was so critical to keeping NPW going for us. So organization, communication was key. We keep NPW on all our meeting agendas. It's always there. Save the dates are there. We are constantly talking about it. So almost monthly, we talk about National Prevention Week. Next slide, please. Just some photos to highlight. So what we did for National Prevention Week, we hosted our second island-wide Signwaving. We did this as a flash mob style almost, where we all came out on the same day at the same time to create this shock factor. Our first year, we had about 8 Signwaving sites. This year, we tripled. We had 24 Signwaving sites and about 350 youth participating on this day. We do plan to go into our third island-wide Signwaving, and we do hope that these numbers even grow more. We're constantly pitching this to our stakeholders, businesses, and other coalitions as well. So not just our coalition, but involving other coalitions. And to emphasize, we are stronger in numbers. We just wanted to show that, like, hey, we may have our differences. We are doing different things. We've got different things on our agenda. But for this one day, can we just all come together and show the island that we care and share our aloha spirit with everyone? And this was very youth-driven. Again, because we had worry of our grant, we had to put trust in our youth, and we had to just go with what the youth wanted, where they wanted to be, what time they wanted to come out, the signs they wanted to make. And of course, the adults facilitated, but just letting them take lead, having them sit in on meetings and meeting around their schedule after school, during school breaks, even weekend work was put into this. Next slide, please. Again, more youth that we've had. I cannot stress this enough. Youth were truly the key in this. We had to take a step back and let them lead and trust them, treat them as if they were our own and our own members and ourselves. So I hope they can watch this and look back at it and just know that we are so, so thankful for them. We do have a youth advisory board as well as youth co-chairs, and they are the heart of our youth involvement. Something I really want to emphasize was hashtags, and we also had our youth teach our adult coalition members what hashtags were. And this was a whole conversation on its own, but this was key in our marketing and our efforts and our social media efforts, was to develop these hashtags that we all shared. And because we were scattered across the island, hashtags kept us connected. So if you do actually Google hashtag HPUD, you will see all our efforts put together as one, and you'll see a bunch of different sub-coalitions who are partners with us and that we're very thankful for. But the hashtags connect us, connect our photos. Anything that the youth posted, they also utilized all our hashtags, and that kept us going. So I cannot stress this whole hashtag thing enough. Next slide, please. Thank you to our Department of the Attorney General, who did a press release for us. And following this press release, we did get sought out by a news feature. So to the left is one of our youth chairs, and she got interviewed, and we had a news feature. And this news feature is still available. So if you do search Hawaii followed with that news article titled "Dance Delivers a Message," you will be able to review this video and to read the article on it. And this, I'd like to really thank a partner. Again, this youth in particular, this group of youth said that they love dance and they wanted to somehow incorporate dance into National Prevention Week, and that's exactly what they did. We let them go with it. We trusted them, and it was just wonderful what they got to put together, which I'd like to show you in the next slide, please. So on the right-hand side was a video dance series that they did. Through this dance series, you could see some of the photos. There was the littles who partnered with their bigs, and it was showing that them talking to their future selves. So the challenge from National Prevention Week, that last one that we had, was the Dear Future Me Challenge, and we took full advantage of this challenge, which I highly recommend you guys to all do, is take advantage of the National Prevention Week Challenge, get involved, and truly trusting it and just letting them run with it. So we partnered with this dance studio. They did this video series. We released one video a day during the week. So that helped us to build some hype around National Prevention Week. We had letters sent to us. We posted the letters. Some of the youth wanted to remain anonymous, so that we kept anonymous, or we did voiceovers in a different voice, so it wasn't them speaking. And we utilized all of the National Prevention Week resources, which helped to keep budget low. We were able to seek out some videographers who were willing to do some pro bono work, photographers who were willing to do some pro bono work, graphic artists, and even then working with the youth. So not even them working with myself as a coordinator, but just organizing them, like, hey, I have a bunch of youth who want to meet you. Can they do some work with you? And I think that's what made their pro bono work a little bit more rewarding for them, and they enjoyed it. They enjoyed working with the youth. They enjoyed sitting with them, spending time with them, and I cannot stress how many hours went into this. So I do, again, thank our partners and our stakeholders. Next slide, please. So National Prevention Week doesn't just end for us during that week. This coming year, we did have some feedback about worries of it falling during finals week or when students were out of school, because our seniors do leave a little bit earlier than the rest of our other grade levels. And our college young leaders are in finals also. So this coming year, we do plan on attentioning National Prevention Week a week earlier during May 5th to 11th, but we will still continue our efforts during National Prevention Week by reposting and keeping the message going. But all year long, we kept going with the Dear Future Me challenge, and we had some of our youth write letters. We did presentations at schools and groups after schools, church groups, and some other youth that were also involved in other partners with us. We had them write letters and we had them open it this coming National Prevention Week. So we do plan out to mail out letters so that they get the letters in the mail. Some wanted to keep it. It meant a lot to them, and we had some who wanted to open the letter on their birthdays during next year. So this was very interesting to us, and they took charge of it on their own. And in conjunction with Dear Future Me, we did start our own efforts. I'll show you in the next slide. So we did continue it. This was, again, youth-driven. Our youth wanted to combat 13 reasons, so they made 21 reasons to stay sober till 21. Our youth met up with our graphic designer, again, youth and our adults at the meetings together. We do not separate our meetings. They hear everything that we hear. We try to be as transparent with them as much as possible. So the youth really took charge of this campaign, and they connected it with the Dear Future Me Challenge. And this was a pledge for them to stay sober till 21, and they wrote their reasons together. And if not, they could come up with their whole list of the 21 reasons, and they shared it with other youth. And they really just took this on, and it spread, and it kept going, and it's still going till today. We just did a presentation last week. So I really have to thank National Prevention Week, all the efforts that it has done for us, and truly trusting the process of it and using all our frameworks and using our partners and utilizing anything that is there for you to do and to continue the work. And we hope this continues. We hope to have a good third year and to keep this going for us.
Well, thank you so much, Crystal. I must say that seeing the number of youth that you have engaged in National Prevention Week and your underage drinking prevention efforts over the years is awe-inspiring. And I can't wait to see some of the results of what you've already shared that you're planning for this coming National Prevention Week. So now, I would like to introduce our next speakers who will bring ideas and lessons learned from a grassroots prevention initiative perspective. In 2014, I believe, Archie Badura died from a heroin overdose at the young age of 19. And as a result, Archie's mom, Lori, launched the Saving Others for Archie, or SOFA Foundation, to raise awareness of the connection between the opioid epidemic and how we view addiction and brain disease. And after over 30 years as an account executive in the business world, Lori brings her passion, as you will hear, her talent, and her drive to this wonderful grassroots effort. Today, she serves as a resource to many across Wisconsin and the country while serving on several alcohol and other drug abuse advisories and policy committees. She works with legislation on making policy changes and holds up the Jump for Archie Jump for Prevention event each May. We are honored that she is also one of our NPW working group and partner members this year. And co-presenting with Lori today is Sara, a key collaborator at the Black Sheep Collaborative that is also based in Wisconsin and is a friend of SOFA. Sara helps SOFA determine, implement, and analyze the most effective marketing and social media strategies and tactics to engage SOFA audiences and leverage those opportunities that involvement with NPW provides for their Jump for Archie, Jump for Prevention events in Wisconsin and across the nation in May. So please, please, please welcome Lori and Sara.
Hi, everyone. This is Lori Badura, and we have Sara. Are you there? Savvy Sara of Sofa.
Hi, guys. It's Sara.
Sara and I are so happy to present today for the Marketing Impact webinar. Thanks so much for your time, and we will be cognitive. We know that this is going to be a little bit shorter presentation, but really a snapshot of a real life highlighting our tools that we use at SOFA and our efforts, and a little bit about who SOFA is. Next slide, please. This is my son, Archie. He was 19 years old when he was about 77 days clean, actually, and really thought he had beat his addiction, but when he relapsed, it was cut with fentanyl, and we lost Archie. And actually, it was, when I look at the date, it was Prevention Week. It was May 15th. So I decided rather than be quiet, there's a roof behind Archie's head, and if you could see it, it's of our home. And I told everybody there that I was going to get up on that roof and shout the word heroin, overdose, epidemic, and make people as uncomfortable as possible because of my small town. It was something you didn't talk about. Next slide. SOFA is driven by prayer and hope and that's really what I like to provide. So we have this prayer, and I just want people to know if anybody ever wants it, the word epidemic is in here, and it's for mental illness, it's for suicide, it's for everything that we are all working on together to try to spread prevention. So we can always share this with you as a PDF, but this is the core and our heart of who SOFA is. Next slide. So we decided when Saving Others for Archie started, it was actually my sister, and she saw my briefcase of the years of going through Archie's addiction, and when she put in the newspaper about where to send funds, she said, we're going to save others for Archie, and that was kind of it. And the dove is a sign for hope. So we wanted to keep our brand and our leadership front and center, and we are grassroots. We love the fact that we're grassroots because we can be an advocate for change on so many levels. As you know, next slide, please. Next slide, please. As you know, it is really important to know where you fit in. Are you in the leader for social justice, where you're inside out change, where you could be working possibly, at a place where you have to be careful a little bit about what you say, or is where you're grassroots, you're more of an activist, and you're outside in your movement, drive, and motivation and energy. And sometimes, a grassroots activist can also go into the leader for social justice. So this is just a really important slide. I think it's good for people to know who they are, and don't forget that as you're planning your event. Next slide, please. So this is just SOFA at its core, strategize for change. And what we like to do is, when I was going through the years with trying to save Archie, there was no custom resource guide, nothing that was in my town or my state that I knew of as a mother. So we created a very custom resource guide. I get about 2 to 3 calls a week from people looking for help for their loved one. And we offer support and empathy more than anything. We just listen. A lot of people just don't listen. People just want to be listened to and not judged. And then we encourage that person, especially the caller, to get themselves help first, and also provide them with several resources that are great within our county. And then we focus on hope and add them to our prayerful intentions. Next slide, please. Your event, when you have a plan of action, you really want to sit down as a group and motivate to think about 6-8 months out, schedule how you're going to make this event fabulous. Get some great ideas, create a theme and action, and really work off what you did the year before. If it's your first year, just look at other events and try to be different from everybody else. Begin with the end in mind. Schedule a date of your event within the tool guide of National Prevention Week that they offer. It's wonderful. That fits in your mission. And then, schedule great keynote speakers and organize people within your city or your state and ask them to come and support your event and see if they will be part of it. Next slide, please. Sarah's going to jump in here. Sara is really fabulous as far as social media and marketing, and she absolutely loved the resources here. So go ahead, Sara.
Sure. Thanks, Lori. I just think it's important to give a call out to National Prevention Week and the partner tools that they provide. We maximize all of the materials that they had posted for us, which harkens back to a lot of the conversation in the beginning about they provide these tools for free, basically. There's videos, PDFs, fact sheets, how-to sheets, a lot of encouragement on how to host local events, and it also gives you structure, which, as we talked about before as well, is really important when you start planning activities and events around National Prevention Week. Next slide.
This one is an actual save the date. You want to get your date scheduled and set and get this out via e-blast and also on social media, and really lean on health and human services within your area, treatment centers, recovery homes, police departments, city halls, schools, you name it. Email absolutely everybody possible to save this date and invite them to be part of it. Next slide, please. And again, this is your key marketing piece. Once you get a really creative event and everything planned out of who's your speakers, your partners within it, people that are going to be supporting you, make sure that this is right. Get your messaging, correct, and make sure it's powerful. And attend as many meetings as you can. And I lean on Health and Human Services, because they will, if you go to any of their meetings, our public meetings, they will push these out for you if you get in their email system. So find your voice, speak and invite, and ask everybody that you know to post up posters and repurpose. Next slide, please. Go ahead, Sarah.
And last but not least, advertise galore. Lori is such a powerhouse when it comes to on the street, grassroots, talking to people, marketing. But there are other additional things to do, tools to use that don't cost much. Facebook is one of our main channels for marketing to our community, which works really well for us. The goal, of course, is to increase awareness of our organization, the opioid epidemic, legislation, and help people find resources for healthier community, healthier lives. Lori is awesome at being somebody who is knowledgeable and can really help. Our Facebook community is about 1,046 followers. Our organic reach at its highest is about 2,300. Our event reach went from 5,000 to 16,000 in 2018. And our response was from 59 in 2017 to 368 in 2018. Leveraging tools, like I said before, that National Prevention Week provides helped me keep a really clean kind of Facebook communication strategy and community. Our outcome was, of course, event support, people offering to assist in grassroots marketing, helping us raise awareness, and event attendance, of course, is a key for us. The one thing I will have to say, going into the event, the more you share and like, and the little Facebook secret about likes is for every post that you get likes on, check your likes, and those who don't already follow you are highlighted, so you can invite them to like your page. So we've kind of been going back and forth and noticed that our followers have increased since we've started actively inviting people to like our page. Anyway, our final outcome at the Jump for Archie at the end of National Prevention Week was, almost 400 attendees. And this year, our call to action was Jump for Archie. If you can't come join us at the Jump, post a video. And I think we were pleasantly surprised when we got national recognition and international. So we had some global submissions for the video, which was amazing, and I think it blew everybody's mind. So make sure that you're leveraging and advertising and generating awareness and asking people to like and follow you. There's nothing wrong with that. And good luck. Next slide, please.
Thanks, Sarah. And to jump off of what Sarah just said, this is a perfect example on this slide, as our town has 5 of these geolocations where a banner can go up. Usually you need to schedule your time 6 months out, but this is a huge way to drive traffic for your event about a week out from your event. Next slide. So about 1 to 2 weeks prior to your event, get your media kit out. Again, invite TV stations and newspapers and schools. Try to get some live press present at your event. And contact events, the sponsored by National Prevention Week, work together in collaboration. It's great to be at each other's events. Next slide, please. On the day of the event, have clear signage and hire a great photographer and videographer. Usually can be a friend too. And this is just some examples of how to make your marketing just really pop. Next slide, please. At the Jump for Archie, Jump for Prevention, we do training for naloxone, Narcan training. So we capture a lot of pictures at our events, and actually we do some tracking of lives and data saved through our event where people actually use the Narcan after being trained at the Jump for Archie. Next slide, please. This is the actual jump. People actually really do go in. It was about 45 degrees and freezing in Wisconsin. Next slide, please. This is the first jump, and it's always good to never lose sight of who you are. The original jump was on Archie's Christian burial. It was 97 degrees in Wisconsin, and we all jumped in the water at my sister's house after burying my son, and we raised our hands to the sky and said we're going to jump for Archie every year. So that's how the Jump for Archie, Jump for Life started. Next slide, please. We also have the Pay It Forward bracelets that we hand out year-round, and these are they offer hope, love, and faith. Next slide, please. These are some pictures that we've done, and actually photo shoots. The one in the right upper corner was actually featured in a magazine of that jewelry line. But there's kids wearing them at prom, you name it. People are wearing the bracelets. Next slide, please. And this is just showing that we had our Attorney General and actually a senator come to our event, and to lean on politicians to help you. And the next slide, please. Post-event, this is the most important thing. It's easy to miss. Capture what happened during the event for social media. Do your live feed, and then capture all the post pictures, the TV, the posts, people commenting. These are fabulous for next year, and you really need to share these all over. Next slide, please. And don't forget gratitude. Thank everybody that attended. Thank the partnerships such as being with David and the group for National Prevention Week. And, just thank everybody and celebrate. It takes a village, but SOFA is really proud to be a preferred partner. And I'm so impressed with David Wilson and his amazing team. Thanks so much.
Well, thank you, Lori. You humble me sometimes every time I listen to you. The efforts that you guys do really remind us on the federal level when we're dealing with all of the gridlock and the bureaucracy of why we do what we do. It's just so impressive to hear what you've been able to build and accomplish in such a short period of time. It's so inspiring. So now you've heard from all of our presenters, giving a grassroots perspective, a local perspective, a state perspective. Now it's time for all of you to be able to ask them questions about their process and hopefully, more importantly, about their impacts. So I am going to turn the Q&A portion of our webinar before we close over to my colleague, Crystal Board, and she's going to walk us through this Q&A period. Crystal?
Hi, David, and welcome, everybody. I'm so excited. What a fantastic conversation we've had today. And as a result, it's prompted a lot of questions from our audience, so I'm going to be happy to kind of lead us through that. First off, there were some kind of questions specific to program materials that I just wanted to kind of share with everybody.
So there was a question that came in about, will these tools be available to obtain before April 2019, particularly if you're a university or college that ends in May? And just so everyone knows, all of the materials for National Prevention Week 2019 will most likely be available before the end of January. So the best way to kind of find out when those materials are posted is to go to the website for National Prevention Week and sign up for the Prevention Works email newsletter. And that goes out every couple of weeks. And as soon as those new materials and resources are available, you'll be one of the first to know. And then another question that came in was about, how does my organization apply for a stipend to do a communities talk town hall meeting to prevent underage drinking? An excellent question. And that information is going to be released soon as well. And so I recommend that you go to that stopalcoholabuse.gov website to find the latest information. They also have an email newsletter that I recommend you sign up for, so then you'll get notified when all that information gets released. And then finally, housekeeping before I open it up for the panel. When will the NPW calendar and planning guide be available? If you're connected to Prevention Works, you'll get that notification right away as soon as it's available in the SAMHSA store. But we're anticipating that it should be available for most people to order by January as well. All right.
Actually, I don't want to get people's hopes up too high, but the official date that I've been given is December the 23rd.
All right. Well, you've heard it here first. But definitely make sure you're connected to the Prevention Works email marketing newsletter so that you can be notified right away in your inbox when you can jump on that SAMHSA store site and place your order. So now I'd like to open up a few questions to our illustrious panel. So a question that came in was, how do you reach out to partners like community-based organizations and state organizations like or agencies like Health and Human Services when you don't know anyone there? And so, Crystal, why don't you start? Is there any kind of tips for how those folks can kind of navigate those systems to create those connections?
For those partners where we did not have an individual that we knew specifically, we did go to their websites, social media sites, try to find anything that we could find anywhere, or if we knew they were going to be at other events, even though it has nothing to do with prevention, but we knew they'd be there, we of course went down, made our face-to-face contacts, handed out business cards. For some, we even sent them direct messages on Instagram. We tried to find phone numbers, did some cold calling, but a lot of it was just constant trying and putting ourselves out there, going to even their meetings, even though it had nothing to do with us, just so that we could meet them and try to find someone. And of course, thankfully here on our island, we do have pretty small network where someone knows someone who knows someone. So we just kept trickling down that road and trying to make as most contacts as we possibly could.
Yeah, I think networking plays a big part, building those kind of relationships, even interpersonal relationships, just within your families and neighborhoods can really open the doors to some interesting partnership opportunities. Lori, how about you? I know partnership is a big part of how you've been able to grow SOFA and had the impact that you've had in Wisconsin and around the country. Any suggestions for kind of how to open doors when you don't know the folks behind them?
Yes, actually, Archie was alive when I found out about Health and Human Services. I actually looked on the website, found a meeting that said alcohol and other drug. It was an advisory group, and it said open public meeting. That means if it's open, it means it's public, that the public is welcome. And at those meetings, there is a time that the public gets to speak. Now, you got to sit through the whole meeting, but it's worth it. You go there. Well, I was mad. I was mad that nothing was being done in our county. This is, like I said, years ago. So I ended up going to those meetings and just raising my voice and concerns. And I made a lot of great contacts. Actually, Sarah's sister-in-law was the director of that meeting, is on my board now, and I made a lot of contacts. And you just show up at those meetings, and you, trust me, you'll make wonderful connections.
Wonderful. Thank you so much. Our next question is actually one that I'm going to pose to David. This question is, what is the theme for National Prevention Week in 2019?
It is inspiring action, changing lives. I love that question where I can just answer it easily.
So inspiring action, changing lives is the theme, and it's already announced and released. So organizations, if you want to start using it and start making it a part of your planning process of how you best want to represent and speak to that theme in your community and for the audiences that you're engaging, go forth and do that, because as David mentioned earlier, it is a year-round process. So we want to be talking about prevention every single day. So go forth and talk about inspiring action and changing lives. Our next question is about evaluation and specifically about social media initiatives. So this question says, can you talk about how you measure or evaluate behavior change of social media initiatives? And so I thought maybe we could start with Carolyn, if there's like some, in general, principles or approaches that people could use for that kind of social media evaluation?
Well, I'm going to actually queer the question a little bit. I think maybe it means social marketing, not just social media. So, I mean, my recommendation with measuring behavior change is look for tangible things that are easy to measure. It's a difficult thing to kind of wrap your head around, but I think, in the Archie example, you saw how Narcan training was a tangible behavior change that was implemented there. I think that's a great example. If your goal is to change people's attitudes about mental health, you might track calls to kind of a lifeline or a mental health chat feature that you're using. So trying a roundabout way of getting to, people's attitudes and behaviors changing. And then at these events, that's a great way to get some community feedback, to ask questions about attitudes around things like substance use, mental health, and see if that is shifting every year. As you're doing these events, are people changing their attitudes around mental health?
Great. And to Crystal and Lori and Sara, who I know social media in particular is a big part of your engagement strategies, any suggestions for how you've been able to evaluate your impact?
For HPUD in particular, we just did a before and after kind of survey. So using our hashtags, what was our number of hashtags before, what was our number of hashtags after, how many posts did we have, or followers did we have before, how many followers after, our best kind of posts, and monitoring what time, where, when, the content. And our youth actually run our social media sites. We do oversee them, but we trust in them, and they've done really well. And to get them involved, and they kind of are up to date with the newest themes and hashtags, and do this, do that, use this platform now, use this thing. So we just monitored more of a before and after picture of what our social media sites look like.
Great. Lori or Sara, anything else to add there?
Sara. I guess we're good.
Okay. That's okay too. So I'll move on to our next question then. This one is about statistics, and I'm going to be posing it to David. Where do you find the best alcohol abuse and drug abuse statistics? And this person was also particularly interested in teen-specific data about teen use?
So, great question, by the way, because I love to take advantage of the fact that SAMHSA has its own data collection mechanism that's called our National Household Survey Data, or NSDA, and it comes out every year, usually in September, and it has a whole wealth of data statistics that we collect, and I believe you can just go to our website, which is www.samhsa.gov, and when you go to that website, there will be buttons just for data, and if you go to the data button, you will get the results of not only the present NSDA data, but data from past years as well. And then, of course, National Prevention Week also partners with other federal agencies as well. So we're not in this alone. So our connection to other federal agencies like CDC offers us the chance to amplify all of the data collection that they do. So hopefully that answers your question.
Great, thanks, David. And Carolyn, is there any kind of things that we should know when we're utilizing statistics as part of our messaging for social marketing campaigns like this?
Well, yeah, I mean, the National Survey on Drug Use and Health, NSDA, that David referenced, is a wonderful resource for the latest data on teen substance use. I noticed the question came from a school nurse who is thinking about using this for one of the school, high school assemblies. And so I would just go back to what we were talking earlier, which is the audience that you're trying to reach. Again, thinking about this group, teens and tweens that you're trying to reach. Are statistics something that is going to resonate with them? I mean, for sure, something that would resonate with school administration, school leaders, but do those youth, will those statistics really mean something to them, or would they be more likely to listen to, say, a personal story? And that's what we were saying with pretesting. Before you go to the effort of compiling all the statistics and doing the assembly, just ask a couple of students, hey, what do you think about these statistics? Do these mean something to you? Would a personal story be more impactful? So just kind of going back to that, think about your goal and your audience before you get to your message. Follow the steps.
Yeah, and just as a reminder, we will be sharing a slide presentation from today's webinar with folks, which will have that handy-dandy circle that Carolyn walked us through, so that you can be very clear about what the best process will be for the most effective marketing efforts. So before I go to the next question, this one is just a clarification. Someone asked if the Stop Alcohol Abuse Town Halls replaced the national town hall meetings that once existed, and they are the same thing. It's just been renamed, and so SAMHSA now calls it Communities Talk Town Hall Meetings to Prevent Underage Drinking. So that's the official title now, but it's the same program. And so if you've been involved in it in the past with a different name, just know it's the same exact program. So next question for our panel, and it sounds like today we have a lot of people representing colleges and universities on the webinar, so we're so glad that you're here. And their question is based about the timing of National Prevention Week. So based on academic schedules, where Prevention Week in May doesn't always fit in, what are activities that can be done throughout the year to still participate in the program? So David, why don't you start us off?
Sorry, I was on mute. I was actually going to say, Crystal, if you had at your fingertips, because I know we have developed a tip sheet for colleges and universities, giving them ideas and strategies on how they can have events and activities throughout the year if they cannot do it in May. And I was hoping that maybe you had that tip sheet in front of you, and you could share a few of the points that came from that tip sheet.
Well,
if not,
Well, from what I recall, I have a few suggestions. Well, first off, I just want to say that all of our tip sheets are available on the National Prevention Week website. And particularly if you're looking for underage drinking prevention resources, then stopalcoholabuse.gov is the place for you to go, and there's lots of resources there too. But off the top of my head, some things that that we know universities have done in the past is that they hold National Prevention Week earlier in their calendar. They just pick a week, whether that's a week of significance for their university community or just a time where it's open, and then they just schedule activities during that week like they would have if it was that third week of May. And then they also find ways of creating like conversations and activities and events that allow for people to have dialogues, information nights, providing resources in student centers and other places in which students or faculty congregate. And so it's really thinking about and going to Carolyn's point earlier of how important it is to really think about your target audience and really gear the strategies and approaches that you're using towards what would be most appealing to them to create behavior change. And so it's your community best, and so really kind of keeping them in the forefront. But looking at the things that are culturally significant for your university, like freshman orientation, homecoming, spring break, activities that happen before the holiday season. So just looking at things that are naturally a part of that university college culture, and then seeing where are the opportunities for prevention to be a part of it. So similar to what David was talking about how to use National Prevention Week to leverage the work that you're doing and the messages that you're trying to express, it's also looking at the existing things a part of your community and what those events and those observances, what those opportunities offer as well. Okay, great. So I think this will probably be our last question. And this is a bit of a methodology question, and so I'm going to open it up to the whole panel. And this question is, how do you assess all components of your original plan have been met? So how do you know when you've achieved what you set out to achieve? So that you've achieved that goal, that you've reached, the audiences that you've met. Maybe what are some of the processes that people have used to do that level of evaluation, or maybe things they set up from the beginning so that they could do the tracking at the end. So I'll just open it up to the group. Maybe Carolyn, if you could start us off.
Yeah, so we touched on goal setting, but we didn't really get into setting objectives to go with that goal. So your goal might be something lofty like increase awareness, which is very hard to measure. So under that, you want to maybe have 2 or 3 achievable, realistic, time-specific objectives that you can tie to the overall plan. So that might include things like, reach X amount of people, or increase calls to the hotline by 20%. Things that you can actually, measure that aren't so vague and lofty. That would be my advice on that front.
Great. David, how about you? Any suggestions? For evaluation processes that may be related to the SPIF? All right. Maybe Crystal or Lori or Sarah, anything to add there of things that you guys have done or used?
For HPUD, what we do after National Prevention Week, we get everyone together who did participate, and we do a SWOT analysis, so strengths, weaknesses, opportunities, and threats, and we just talk it out and hash out what we can, and we immediately prepare for our next National Prevention Week efforts.
Great. Lori
Hi,
and Sarah?
This is Lori. We do the same. We gather as a group, and we try to capture every piece of media, whether it was in print or social, everywhere. It takes a lot of time to do it, and the videos, because Jump for Archie, Jump for Life, as Sara had mentioned, we have people uploading videos all over the world now. And so we really meet and try to just highlight what worked, what didn't, and just so we have a clean slate for jumping off for next year and really try to make our next event even better. We have an event tonight that Sara and I are going to, and we're constantly listening, and am amazed at how many people still, even though we do this over and over, we just have to remember that not everybody knows the depths of what we're doing, and we have to just re-emphasize the messaging that we're all doing.
Great, thank you so much. So this is Crystal again. So that was our last question, and we received a lot more questions that unfortunately we didn't have time to cover. But want to thank everybody for submitting those. If you think of something that you didn't get to share today, remember the contact information for all of our presenters are a part of this presentation deck, which you'll be receiving via email most likely in about a week, with a recording of today's webinar. And so you'll be able to share it with colleagues or rewatch certain parts of it that you might want to see again. But you'll be getting those resources. So we would love to kind of hear what you thought about today's webinar, so please fill out the post-meeting survey. It will pop up once the meeting ends, and your feedback is very valuable to us as we plan the other webinars that we're planning to do this year. Just as a reminder, if you have NPW plans already, please tell us about it. So just visit the website and go to the community events and activities form and share with us what you're planning on doing. And it doesn't have to be what happens that week. It could be what you're planning to do next month. We would love to hear about it, and if you have photos and videos, please share that with us as well. And we want to keep you well informed of the latest resources we have available, as well as activities and opportunities we think you might want to leverage to amplify what you're doing. So sign up for Prevention Works email, and that link to how to do that is on the samhsa.gov/prevention-week website. And with that, thank you so much, and I'll turn it back over to our Ready Talk operator.
Great. Thank you so much. And ladies and gentlemen, again, this does conclude today's webinar. We thank you so much for your participation. You may now disconnect.